I'm here for Shad, and I work with CaDHRI as well.
I'm Nancy Cripps, and I'm administrative assistant.
She's responsible for lunch. So thank you.
Thank you. Can we get the folks in the back row?
I'm Jordan Lee. I'm a first-year doc student in exercise physiology, and I work in exercise oncology with Kirsten and Ira.
Great.
I'm Aram John, PhD student in nursing. I'm Jaron Wu, faculty member in school nursing.
Perfect. And did we get you?
I'm Nicole Cranley. I'm a postdoctoral fellow in the Cancer Health Disparities Research Program.
Mm-hmm.
I can just give a quick pitch. My name is Brian Moynihan. I'm the head of Health IT here at the Health Sciences Library, and I'm the director of the Carolina Digital Health Research Initiative. So this is put on by CaDHRI for a chart chat today. CaDHRI is the Digital Health Research Initiative, and we have devices for researchers that want to use digital health in their research. We have consultations with different researchers to see how we can help hook them up with the things that they need, some support and expertise, either on the health side or the maybe HIPAA compliance, or a lot of times technological side of things, implementation. And also we have a series of workshops. So we have a 6-workshop series and some events that go around it with it. And this is what we wanted to do here, was just show one of the options for building things on campus. And I think many of you are students, which is good because you may be able to get this for free. But otherwise, you could pay for it as well. So we're very happy to have you guys here, and thanks everybody for coming.
Great. Did you want to introduce yourself?
I'm Barbara Alvarez-Lyons. I'm the Director of Research Development for Cancer Prevention and Control at Lineberger.
Awesome. Well, thank you. And it is exciting to have a lot of postdocs and doctoral students in the room, because we do have some opportunities for you guys to use CHART if you would like to in your research. So for most of the slides that I'm going to present, we're going to walk through the background of why CHART was built, the way that this data collection tool looks, so you can get a sense of what the user interface looks like. But first, I want to give you a sense of what cancer prevention and control is and why we have built this tool. Lineberger has a lot of researchers who are members of the center across a lot of different health topics. And with cancer prevention and control, we have around 50 researchers at UNC who are members of this individual group. And the researchers in cancer prevention and control are focused on preventing cancer and also improving cancer outcomes. And these are our 4 focus areas of our group. So we're looking at health promotion interventions, cancer health disparities. We're looking to improve health education, and we're looking at mobile health, or mHealth, which is a really big topic over the last 5 years or so. We're looking to improve cancer survivorship as people transition from active cancer treatment to the next steps of their lives. How can we make their quality of life good when they leave cancer treatment? And last but not least, we have a group that's looking at patient-reported outcomes. So asking patients while they're undergoing cancer treatment how they're doing, collecting their symptoms, and having that improve their outcomes, hopefully. And CHART, as you'll see, is a really flexible tool that can be used across all these different areas, and that is one of the reasons why we've built it. So what is CHART? CHART is an online platform that Lineberger has funded to help researchers collect health behavior data and provide tailored feedback to study participants. It was started by Laura Linan in the health behavior department. She started CHART originally as pencil and paper, and then Lineberger funded the development of it into an online platform. So it really has been built by UNC researchers for UNC researchers. It's a tool that's here for you all to use and the research community here. And our overall goal is to simplify research and also to enhance behavioral interventions. And when I say enhance behavioral interventions, this is what I mean. This is the evidence base behind CHART and why we built it. We know from the community guide from the CDC that when you provide someone with a health risk assessment, you pair it with tailored feedback, and then you add additional health education or an evidence-based intervention on top of that, then there's strong evidence for behavior change. And so with CHART, we're providing you with the first two components of this equation. So we're giving you the platform to collect the health behavior data and the health risk assessment and provide whatever tailored messaging you want to provide. And where research teams come in is you compare that feedback with your own intervention or additional health education, whatever you have in mind. And then this is what we study. The behavior changes is what we study. So the next few slides will walk through the functionality of CHART, how we collect health behavior data, how we provide tailored feedback to study participants, and I'll also walk through the administrative portal of CHART, which is where you as researchers would control your study information and download your study data when you're using CHART. So the first note here is CHART is module-based. We built it around modules on purpose because we know that researchers are interested in different health topics. We have built already 15 different modules, and each of these is focused on an individual health behavior or health topic. And we don't have the titles of these individual modules up here, but hopefully you can infer a couple of them. The shoe at the very top left corner is physical activity. Right next to that we have alcohol use, eating habits, tobacco use, and weight management. And when I say module, that means the question bank, the survey that people are collecting information on about that health topic, and it also includes a message library that corresponds with that. The other thing I want to note is we developed 15 modules here, and you can see, maybe hopefully inferring from the icons here, we've come from a preventive health focus, but in the last couple of years we've had some more clinically focused modules that have been built. So the last two especially, right here and right here, that's a lung cancer screening decision module, which I'll talk about in a little bit. And right next to that is a medication adherence module. So we have a lot of different topics we've already, or a lot of different modules with different content that we've built already. When you use CHART, you can decide to use our modules unchanged, kind of take them off the shelf and use our exact question bank and our exact message libraries by themselves. You can choose to adapt it, and that means editing our question bank or editing our message libraries to suit your needs. Or the last option is if there's not content already built that you're interested in using, you can create a new one. So with our CHART questions, for the modules that we have already built, which are available to you all, we do ask about current health behavior status. We want to know how the study participant is doing in that specific health behavior area. And we also ask about behavior change constructs. So for those of you from health behavior, this should look pretty familiar. We ask about readiness to change, barriers, self-efficacy, and social support. And the way that the respondents answer these questions drives the feedback that they get when they use CHART. So when they get tailored feedback, it's corresponding to the barriers that they're telling us they're experiencing, the level of self-efficacy they have, etc. Yes.
A few questions along the
Oh,
way.
sure. Yeah, please stop me.
So for the question bank, or what we're
Yes.
seeing now, so are these evidence-based? Have they been validated? What's kind of the background
Yeah.
measures?
We do, and that's a good question, we do have a website that I'll send all of you all where you can see the questions that we've built or the question banks that we have for the modules. And we do have questions pulled from validated sources. Some of them are adapted from those sources, but we have the specific, we basically have the exact information that you need on that. If it's from BRFSS or if it's adapted from a certain source, you can see that. Yeah. Mm-hmm.
Sorry if I missed it.
Yeah.
But is CHART intended to be something that's done electronically on an iPad or computer?
That's a good.
By a participant?
Mm-hmm, that's a good question. It is an online tool, yeah. So it's designed. It's a good segue, but it's designed with responsive design, so you can use it on a tablet or a smartphone or a computer, just as long as you have access to the internet. We do also have the ability to create teleforms. So if you know that some of your population just will not have access to a computer or device, we can work with you on that. But yes, it is chiefly designed to be an online tool. Yep. All right. So in terms of feedback, we can provide automated feedback in two different ways. One is module feedback. So this is over on the left. You see this little meter over here. This is the infographic that we've developed for our weight module. This is just an example of one of our infographics. And the module feedback is generated when someone completes that individual health behavior survey that you have for them. The infographic is designed to tell them how they're currently doing, what their current health status is, and how they compare to the public health recommendation or the behavioral goal that you have for them. And I'll also show you a screenshot of what that looks like in a minute. And with the summary feedback, once a participant completes all the different modules that you want them to complete, whether it's 2 or 10 modules, the summary feedback is a way for them to see at a glance how they're doing across all those different health behaviors and how they compare to the public health recommendation. Again, I'll show you examples in a moment. So this is what the portal actually looks like. So you have an image in your head. When a study participant logs in to their chart portal to take the survey that you build, this is what they will see. And over here on the left-hand side, this is what you as the researcher or your research team would build. Right now, this is a fake example, but we have about 10 different modules. That would be a long survey for someone to take, but it's just for the sake of examples. You may have one module here, you may have 5 that you're interested in looking at, but this is what you would decide for the study participant to walk through. And then this is what it looks like, the way the questions are formatted. So to your point, it's designed with responsive design. These are touchscreen sensitive, so someone can take it on a tablet or a smartphone. And we have made the buttons big so that people can answer more easily. And when someone walks through your study participant walks through their survey, these gray clipboards, I know it's hard to see up here, but this is a gray clipboard, and that tells them that they have not completed that module yet. When they complete their module, it turns to green, and that's when they can access their module feedback, or the tailored feedback that's specific to that health behavior. And then once they complete all of the different modules, this down at the bottom, you'll see another screenshot in a minute, but this will turn green and they'll be able to access their summary report. So this is just generally how it looks. We also have a progress bar at the top so they know where they are generally. So for the module feedback, this is a screenshot of what it looks like, and this is for the weight module. So again, someone just completed their weight survey, and the little clipboard turned green with a little check mark, and this is what is generated. So we have the infographic that hopefully you recognized from a couple slides ago, and it shows them how they're doing and how they compare to the public health recommendation. We also have this language here, which is a statement on the importance of weight management, or the behavior in general, and then this is where individuals' tips and strategies come up. So if someone is telling us they have specific barriers to weight management, then a phrase from the message library would pop up here depending on the algorithms that you have. Another note is if you are editing one of our modules or if you're creating a new one, you have control over what the content is here. This is just giving you an idea of what it looks like. This is an example of a summary report. I'll show you a couple different examples of what our summary reports can look like. And so here, someone has walked through all of the modules that you have for them. They can click on the My Health Behaviors tab here, and then this is what they see. This is one idea of ways to compile all the information into one place. And here we have all the infographics from all of the different health topics. It's cut off a little bit. There are more that come down here, but it's just an easy way at a glance the person can see how they're doing and how they compare to the recommendation. We've also, with this new design of chart, we've designed the health behaviors in cards, because we know that that's something that people are used to seeing now. Like if you have a Fitbit dashboard or account that you use, something people like to see. This is another example of a summary report. It's more simple. We're using gold stars to signify if someone has met the public health recommendation or not. So if they haven't, they have a light blue bar up at the top here. It says what their current behavior is, and it says what their goal is for that individual behavior. And then if they have met it, they get a gold star, which is very exciting. And then they have goal met right here at the bottom. One note here is that with our summary reports, we've designed them to be focused towards the study participant. But as you're thinking about how to use this tailored feedback, you may have other people or other parties in your study that this may be useful for, like caregivers or providers. So you can have an open mind of who could use this type of information, and we can build a report based on that, or build feedback based on that. This third example is showing progress. So with CHART, we have studies that use CHART at baseline and then follow-up administrations. And this is a way that we are showing progress. So if someone takes CHART at baseline and then at the follow-up administration, they've achieved the behavioral goal. Here for fruits, it's eating at least 2 cups of fruits every day. They get 3 stars. If they have improved but they haven't achieved the goal yet, they get 2 stars. If they haven't changed at all, they get 1 star. And if they have backtracked, if they're doing worse, they get no stars up at the top. And last but not least, this is a summary report showing readiness to change. So if you have an intervention or health education which is based off of the idea of the study participant having plans to change in the next 30 days, 6 months, having no plans, this is a way that we, this is what we've created to help communicate that. We're kind of gamifying the information that we've collected in the surveys and put it here. So with this bar, they're different, it's filled in differently based on the person planning to change now, changing soon, if they've met their goal, or at the very bottom, if they don't have plans to change, it's just empty. Are there any questions about the example reports here? Yeah.
Well, I was wondering if for patients and participants in a study, would they have reminders to use their input their data at all?
That's a good question. So with CHART, and in fact, thank you. With CHART, the study team is in communication with the study participants. So right now, CHART does not send automatic alerts to the study participants. We have our own IRB approval for CHART already, and we don't have identifying information in CHART. So you, as the study team, would be in communication with your study participants, sending them emails saying, please log in and complete your assessment or reassessment. Yeah, good question. So that does bring up the administrative portal. Oh,
Sorry.
yes.
And sorry if I missed this.
Yeah.
As far as getting these data back to the researchers or back to whomever, what's the output? Or is that where we are?
Right here. Perfect.
Yeah.
Thank you.
Oh, yeah.
Good question. So we have a little button here that says export data. So with the administrative portal, this is where you upload participants to CHART. This is where you can manage your study groups. You can also decide to turn off and on feedback that you want for the study participants to see. And this is also where you can print off the feedback that your study participants have received. So this is kind of your data control central for your project. And we do have Excel spreadsheets that you can download 24/7 access whenever you want, and that's here. This also shows you, for the current administration of CHART for your study, the completion rates of CHART. So it shows you the numbers of participants who have completed their survey, which ones are incomplete, not started, so you can make sure that you manage your communications well. Great. So who's using CHART? We have 14 projects that have used CHART thus far at UNC across 9 different departments. And I'll walk through a couple examples in a minute. But it's been really fun to see when we provide this platform, the ideas that people come up with to use it. So we've seen people use it in the community setting with more preventive health focus, and we've also seen use of CHART in the clinical setting, which Barb will get into in a minute. But it is fun to see the wide use of CHART. So the first example here that I'll cover is an intervention called CARE, and it's led by Diane Ward in nutrition and Laura Linan in health behavior. And with this study, this is a large study in North Carolina focused on child care centers and child care providers. It's focused on increasing levels of physical activity. And so with this project, the child care providers are taking CHART at baseline. They're taking CHART after the 8-week physical activity intervention and then 6 months later as a follow-up. And they're using CHART as an evaluation tool, so measuring people's health behaviors, but they're also using the feedback as a part of their health education. So it just gives you a quick sense of how they're using it in the CARE study. I also want to note that they're using a pilot, or they're doing a pilot study to look at our wearables module. We do have a cool wearables module that Derek Hales in nutrition built, and it's a way that we can pull in Fitbit data and sync it with CHART. So we use Validic, which is an API that allows the Fitbit and CHART to talk to each other, and people can set weekly goals of increasing their steps based on that. So it's just something cool for you to think about. Next is a project by Lishan Song. This is an intervention called PERC, prostate cancer education and resources for couples. That's what it stands for. This is a website that prostate cancer survivors and their partners can go to after the prostate cancer survivors have finished treatment. And it's a place where they can get information on managing the symptoms from cancer treatment. And CHART is built into this online intervention. So I wanted to put this here so that you can think about that. With CHART, there are different ways that your study participants can access it, but CaDHRI, which is a group at UNC they're a programming center. They have built CHART. They also build study websites and intervention websites, so they can build CHART into a website if you're interested in that. This was exciting. Lishan Song used CHART and PERC in a pilot study. She had really good success with it, and she's just gotten a really good score on an R21 grant. So it's just showing what we hope CHART will be used for, which is leveraging external funds and helping forward research at UNC. And last but not least, this is a more clinically focused use of CHART, and this is the lung cancer screening decision module, which I talked about earlier. This was a pilot study led by Dan Royland and Allison Brenner in the School of Medicine. They built a lung cancer screening decision video, and then they embedded it into a CHART module. So they had, in clinic, study participants walk through the survey, asking them about their knowledge surrounding lung cancer screening, their feelings and opinions about it. They had the study participants watch the video and then answer a battery of questions after that. So they just tucked it all into one module. So that's just a cool example. You can kind of see from the community setting to the clinical setting, there are lots of different ways that you can think about using the online platform to deliver some tailored feedback to study participants. Are there any questions? Great. Okay. Well, at this point, I'm going to hand it over to Barb, who's going to talk about some of the uses that we are seeing for CHART in a clinical setting to help you do some brainstorming.
And just to underscore what Hannah was saying, CHART is really flexible and adaptable. We want it to be that way because the sky's the limit in terms of how people come up with different research studies. So we want this to be flexible and adaptable. So for some, they use CHART, but they just want to use it as a pre-post evaluation and they don't want to use the tailored feedback. That's fine. Others want to they have an existing intervention that they're testing, and then they want chart to look sort of seamlessly built in, like it was always there, and that's totally fine. Others, chart is beautiful and prominent, and then off of chart in the tailored feedback is where they will launch an intervention, say a video, like Dan Royland was doing. So there are a lot of different ways to incorporate it. And one of the things that we're really interested in at Lineberger is to look not only at health behaviors from a preventative standpoint, but how can chart be used in a clinical setting? How can chart help to improve the clinical experience? And so we actually had a meeting with the Lineberger Cancer Director, Dr. Ned Sharpless, a couple weeks ago, and sort of painted this vision or this idea for him. So imagine provider and patient right now, maybe in the cancer center. And we've talked a lot with folks about what are the pain points that folks are feeling in the clinical setting. So for the patient, we know that many face behavioral risk factors. We did a quick search on I2B2. If y'all don't know what it is, talk to Brian. Great source for finding data. And we found that there are almost 600,000 people who've gone through the UNC healthcare system who are overweight or obese. So they've got some really serious health issues just from that. We also know that patients are not receiving actionable information when they go to their doctor visit. I don't know if anybody's been in a clinic visit, but you get this much information and it's really quick and it's about your health issue. And then you leave and you're so overwhelmed, and then you think, well, he didn't talk about my diabetes, and he didn't talk about the fact that he didn't even ask me what I'm eating or whether I have good nutrition, or am I getting any exercise, or am I managing my stress? All of those things we know have big effects on health outcomes, right? So chart with these modules, I think, can provide a way for people to think about what their health behavior risk factors are, and then bring those to a clinic visit, for instance, or talk about it within the visit. And also, kind of tied to that, oftentimes we get into a clinic setting and then we're talking about the immediate issue right then. I'm feeling pain because I'm on tamoxifen for my breast cancer, and so my oncologist increases or changes my meds. But we didn't talk about any sort of maybe behavioral, what can I do to help reduce my pain? What can I do when I leave the clinic other than popping pills? So these are some of the pain points that we hear from patients. Are there any that you would add to that patients would be feeling that would be issues for them in the clinic?
Yeah, they're innumerable, and for caregivers as well.
Yep.
What was that?
I said they're innumerable, and for caregivers as well.
Oh, okay.
Yeah, we're not even talking about all the issues of communicating with the caregiver, right? And actually, I'm glad you mentioned that point. When Hannah was talking about the tailored feedback that comes from the chart modules, right, what you saw was everything that could be delivered to the person who's filling it out. We're actually working with a couple folks to develop a module for caregivers about them being taking care of themselves. Because oftentimes we forget about that. You know, it's all focused on the patient, but, you know, I'm taking care of my 90-year-old mother, and I'm feeling a lot of stress, and I'm not eating well, and who's taking care of me? So those are some issues. And you can also have a feedback going to the caregiver. So say I'm the patient, I'm filling out, talking about my stress and whatnot. I, as the patient, can get some feedback that's tailored to me. But it might be important for my caregiver here, Hannah, to have some separate information that helps her then be able to be a better caregiver for me. We're able to do that with chart as well in terms of feedback. Or maybe Brian is my doctor and we want to have a summary for him about what he should be targeting based on my answers and what my barriers or what my stress points are and how I filled out charts. So there can be a different kind of feedback for Brian. Excuse me, Dr. Brian. Okay, so in terms of pain points in the clinical setting, there are also a whole bunch for clinicians. These are just a few that we have heard from, that we've heard about, that we're trying to address through chart. So we've talked already about minimal time. There's lots of stuff that they have to cover, and oftentimes they're not even getting to talking about
the breadth of symptoms that patients could be experiencing. Or if they do, maybe they're not interpreting those symptoms correctly in a way that gives actionable data. Clinicians are also, and this is one that we've heard from a lot of folks, maybe here's your pain meds, but are they following back up? Has your pain been reduced? Have you been taking the meds? Have you had any other symptoms based on the meds that we've just given you? How's your nutrition from that? Is it impacting your ability to eat? Like all of that follow-up, we're hearing that's a really big pain point, that it's just not happening. And then finally, for all of this, it's in UNC, it's happening with an EPIC, within the CaDHRI, right? And so we know that it can be very burdensome to use. It was not meant to be, the great panacea for all of our health behavior issues. So trying to modify it also can be very challenging. And just tracking patient progress, it's not optimized in a way that I think many of us who are in health behavior would want it to be. But that's not its intended purpose. So back to, I'll call them Bob and Janet. I was telling this to Hannah, and then I realized subconsciously those were my grandparents' names. How weird is that? And he doesn't really look like my grandfather. But anyway, so imagine Bob and Janet are here, and coming in to talk about issues that she has. Maybe Bob is Dr. Bob is her oncologist. And so maybe in the waiting room, he has, or the nurse gives Janet charts. And she goes through, maybe there's some particular modules that she's been assigned to. And out of that, weight, and imagine this one being pain. Those are two that are really important. And so she goes out, she gets feedback to herself that gives her some really good tips and strategies for her to address weight management. Maybe there's a report back that can go to the physician related to pain. And maybe on the weight management one, maybe there's a study here at UNC on wearables. And so chart in the field actually put her to the wearables module. Maybe she even gets assigned a Fitbit. And then she's in that study looking at weight management. Maybe on while all this is happening, she's done the pain module. Some of the feedback actually goes back to Dr. Bob. My analogy is just going to keep on going here, or my story. And based on him receiving that information from the chart feedback, he decides, we're going to make some adjustments to your prescription medication related to pain. But you know what? There's also a medication adherence module in chart, and I think that would be really good for you to do. So he adds that into it, at which she then can get some tips and strategies on how to better adhere to her medication. Maybe that gets fed back to the doctor, so we have that follow-up. All of this, if this is a cancer patient, there's a really big push right now for survivorship care plans. It's something that is required for all patients who have gone through active treatment. So what if all of this is now actually connected to that survivorship care plan, and there's a link off of that to go to chart so they can continue to monitor this after they leave active treatment and now they're back with their primary care physician. That communication between oncologist and primary care physician has been a really, there's very little. It's been a big concern. And then we talked a little bit about EPIC. So if we're imagining, we're just painting a big vision here. Let me go back. So there are a couple places that we can envision trying to build this into EPIC. So whether it's down there with the physician, whether it's when you're talking about pain meds and sort of a prescription to take a module, or maybe it's the information that the patient's putting in, having a way to have that go back into EPIC too. So there are a lot of different things that we're thinking about. So I wanted to just, that was the sort of the clinical setting, vision, if we could put it out there. I wanted to just briefly give you some other ideas for how folks are using chart in a clinical setting. So you know that chart has these questionnaires and these the feedback, these personalized reports. So some are just using it where it's very, very simple. It's chart plus your intervention and however those might work. So, for instance, it might be a coaching intervention, and based on the feedback from whatever module the person does, that feedback actually goes to the coach, and they're able to talk about it. Some people are interested in that. And maybe it's within a clinical setting. Or maybe, as I discussed earlier, maybe it is just literally looking at a pre-post, and there's no feedback at all. Dr. Barbara Fredrickson in CaDHRI is actually using it with a mindfulness survey, one of those 14 that Hannah was talking about. Other folks, like we said, are actually embedding chart into their intervention. Hannah was talking about Lishan Song and nursing. So she has her existing intervention called PERK, and chart is just embedded in there, and it looks kind of seamless and part of her intervention that she's testing. And then others are doing it exactly in the opposite way. We've had 4 or 5 studies now that have actually created a new module. Things that we hadn't even thought about: a decision aid, the wearables module, medication adherence. We're now talking with folks about financial toxicity and a module for caregiver support, which I mentioned before. So the ideas just keep blossoming, which is very cool. We're also talking about creating ones based on symptoms. So a module on pain or a module on fatigue, different than some of the other health behaviors, but also very important. A third way, and Hannah talked about this in the beginning, is adapting an existing module. So for the lung cancer decision support one, they actually adapted our tobacco module to use it for their study. It's on my screen but not on yours. Another one that was done as a pilot is Dr. Rosenstein in CaDHRI took 6 of our modules and culturally adapted them for Spanish speakers. So we actually have 6 of our main modules, I guess, culturally adapted, so for Spanish-speaking audiences. So you may do it for a particular audience, or you may do it for a particular region. You want to work with just folks in clinics in Greensboro, or just with the Lumbee tribe, or something like that. So you can also look at adapting it in those ways. And then finally, we are very interested in ways that chart can be integrated, play nice in the sandbox with Epic. So does that give you some ideas about how chart we have, they're untold, but we just want to plant lots of fodder out there for you. On our website, which we'll send, right now it's still the development site, but it'll be going live later by the end of this year. We have little blurbs on each one of the 14 studies that are currently using it, just to also kind of give those ideas.
How far have you progressed on the Epic integration side of things?
Oh, that's the slowest part of it right now, unfortunately. But it's something that Lineberger is very interested in. So we keep hitting against that wall to see if we can break through.
And do you know that you can use like open standards through FHIR or anything for that, or is it just going to be kind of a one-time connection between the systems?
Good. That's a good question, and I don't have an answer for that yet. That's more of something with talking with Arlene Chung about.
And I was curious about bidirectionality. Is it into Epic, out of Epic, or both?
Well, I mean, ideally, both.
Yeah.
Great.
That'd be great.
Yep.
Yeah.
Any other thoughts on how? Yes, ma'am.
Is there a fee for using chart?
We're gonna come circle back to that.
Planted you.
All right, so to wrap up, these are just a couple of the benefits that we cover with folks when we tell them about chart. One is it's adaptable to project sizes and locations. You can see with hundreds of participants or a few in a pilot study, it can work well. It's accessible on multiple devices. It's built to be used on tablets or smartphones or a computer. You do have access to your data at any point. So you can pull down a spreadsheet and enter it into SAS or Stata. And last but not least, it is affordable. It's been heavily funded and subsidized by Lineberger, and so we want UNC researchers to use it. I'm going to go back here just to cover the basics of, if you're interested in working with us, how that actually works. The first step is meeting with myself or Barb to think through the basics of your study, and with any researchers who use CHART, we develop the general ideas. We pull in CaDHRI so that they can develop a scope of work and a bid, so we can all agree on it before we move forward on the project idea. And after all that has been agreed upon, then you basically build your CHART portal. Once your modules are edited or created, or if you're using our modules off the shelf, then you are basically set free to use your CHART portal however you want. Upload your study participants, send them their link to access it, and then your participants complete their CHART survey. And then down the line, the participants, once they finish their surveys, they see their tailored feedback. You compare it with your additional education or interventions, and you can download your data. So at the beginning, we work with you to make sure that we have the nuts and bolts of what you want to do, and we make sure that CaDHRI comes in to help with whatever they need to help with.
We see those who use CHART, the researchers, as the content experts, as the study experts. So we're providing a platform to use. But in terms of creating new modules, for instance, y'all are the experts on that subject.
Exactly. So the good news is we do have some funding available to help with doctoral projects using CHART and postdoc projects. So it's a value of $3,900 to $10,000. And I'll cover the application in a moment. But any projects that Cancer Prevention and Control funds will be funded with the understanding that your findings will be submitted and published in a peer-reviewed journal. I'm just reading the small text here. So we do want to make sure that what you're doing will be published and will be advancing your own careers and your own research agenda. And to that point, hopefully you all have gotten the handouts that were over there in the corner. If you are interested in using CHART, we just have a couple of prompts. We'd love to collect some basic information from you if you're interested in accessing this funding that we have. And we would just ask that you complete that and send it to me by December 16th. And I'm happy to meet with you. If you have any other questions about CHART, you want to think through things a little bit more, I'm happy to meet with you to think through that. And then our leadership team with Cancer Prevention and Control will meet, and we will let you all know about our funding decisions January 20th, by January 20th. Any questions?
I do have a question.
Yeah.
So, on your website, is there a place where we can see, like, basically, like, data definitions, like, all the different questions that you have for each of the modules?
Yes,
We kind of
yes,
okay,
we will send that to you.
Okay.
Yep. We absolutely do. And in fact, I may just end this really quickly and pull up our website. And I think you had a question too.